So tendonitis is when a tendon is injured and that results in pain and swelling. This can happen in the acute setting following an injury, for example, and that tends to last for a few days to a few weeks. If the symptoms, however, last for more than a month, then this is called chronic tendonitis. Often tendonitis occurs in isolation, but rarely it can be associated with other inflammatory conditions such as inflammatory arthritis, psoriatic arthritis, or ankylosing spondylitis, most typically. Tendonitis typically occurs in tendons that are involved in stress and in heavy loading. The most common tendons, for example, is the Achilles tendon, because if you think about the heel, it carries the body's weight, particularly when we're walking or running, for example. Other common sites of tendonitis include the shoulder, often, for example, with sporting injuries, tennis players, the elbow, if you've heard of golfers or tennis elbow, and also the tendons around the hip, particularly in runners or joggers. But of course, tendonitis can happen for people who don't do sports, but typically it is the loading tendons which are affected. Tendonitis can be very unpleasant and cause a lot of distress and symptoms. Typically, tendonitis causes pain. It also causes stiffness. Because of the pain, movement of the joint can be affected, and this leads to reduced mobility. There can also be a sensation of cracking or stretching underneath the tendon when trying to move it, and this can be very uncomfortable as well. Tendonitis is really a clinical diagnosis. The history is really important. Understanding if there's been a mechanism of injury is key. But also if there's an inflammatory systemic disorder, that also enters into the history. If we wanted to do diagnostic tests, then the most useful test to do would be an ultrasound scan, which can identify if the tendon is swollen and if it has inflammation in it. An MRI can also give some detail of surrounding structures. Now, as a clinician, I may request x-rays as well, but that's if I suspect there's an abnormality in the bone, because x-rays, you can't see the tendon, so you can't see tendonitis on x-rays. It's mainly for looking at the bone. So tendonitis can be acute and it can be chronic. In the acute setting, often after an injury, for example, the main treatment is by resting the tendon, avoiding movements that make it worse, applying ice to the area, and then support, whether it's with a bandage or with a splint. Now, it's important to remember that you shouldn't wear the splint at all times because it's really important to slowly move the muscle again to avoid stiffness. In the chronic setting, however, things may not improve. And at that point, you may ask your pharmacist for a simple anti-inflammatory. Ibuprofen gel, for example, or even tablets can be helpful. If that doesn't work, then you may need a referral to see a specialist. Some of the advanced therapies that I would offer in my clinic would include things like a steroid injection. And that can be helpful to help relieve some of the inflammation, to allow movement of the muscle to occur. Physiotherapy is the cornerstone of tendonitis management. It's all about slowly rebuilding the tendon strength and the muscle strength and avoiding stiffness. If that doesn't work, then other interventions are available. There is some evidence for shockwave therapy, and also, which is basically putting an ultrasound probe on the tendon and using pulses to help stimulate the repair of the tendon. Other treatments include plasma-rich platelets and sometimes even surgery if necessary. Tendonitis can be prevented. It is very important to understand that tendonitis happens due to sudden movements or injury, often when a muscle or a tendon is not warmed up or is not used to that movement. So I think the key thing to advise to avoid tendonitis is to warm up when you exercise. Make sure that you don't do a sudden new sport without appropriate clothing and kit. Footwear, for example, is very important, particularly if you are a runner or a jogger, for example. Ensuring that the mechanism or how you do the exercise is with proper alignment and posture. And this is particularly relevant for people who go to the gym and may carry heavy weights without realizing their posture is out of sync, and that puts you at risk of tendonitis. It's also important to recognize, though, that some conditions are inflammatory and are related to the immune system. For example, psoriatic arthritis or inflammatory arthritis. In those situations, it's very difficult to prevent it from happening. And that is when seeing a rheumatologist, for example, is important because the treatments are very different as they target the immune system.